Moving on now to the W-2 reporting. This one does have a small employer exception. Essentially, employers that provided or issued less than 250 W-2s in the prior year are exempt from this requirement until further guidance is issued. But if you did produce more than 250 W-2s, this requirement applies for the 2012 calendar year. So folks who received W-2s in January of 2013 are going to need to have the aggregate cost of health coverage reported on their W-2s. And you're probably, hopefully, all working with your payroll vendors to ensure that you can meet this requirement. And from an employer standpoint, I think the most important thing to understand and the most difficult thing to deal with will be the employee inquiries. When folks receive their W-2s, if they're not aware of this requirement and they take a quick look, they might think that the reportable cost is included in income or that they pay taxes on it, and so you're just going to be responding to employee inquiries and letting them know that this is purely informational. It's only for their own comparative purposes when looking at other plans and things like that. When you are reporting the cost, it includes the entire cost of the coverage, employer and employee contributions. The cost of coverage is determined under rules similar for determining COBRA premiums. So it's essentially, the cost of the plan to the employer, excluding that 2% administrative charge. Another requirement coming into effect in 2013 is the limit on employee contributions to healthcare FSAs. This is effective for the first plan year beginning, or the plan year that begins in 2013. It does not affect employer contributions that are non-cashable, so it really only affects employee salary reductions to a health FSA. And we are recommending that you notify employees before the beginning of your 2013 plan year so they can make their elections accordingly. And we also recommend that you have your FSA plans amended before the start of the 2013 plan year, just so that you have an updated document that has the current limit expressed in it. There is a bit of a safe harbor here that permits employers to adopt the amendment retroactively as long as they have complied with the amendment operationally starting in 2013. But again, we're not really recommending this. We'd rather have employers amend their plans before the beginning of the year, just so employees can be adequately apprised of their rights and responsibilities. I wanted to make quick mention of the non-discrimination rules. These currently apply to self-funded plans, but they were intended to apply to non-grandfathered, fully insured plans under PPACA. This guidance has been delayed, or these rules have been delayed until further guidance has been released. And so this is something definitely to watch out for, although we have no idea when we might see rules on this. Another fee that is coming down the pike here for self-funded plans is the Transitional Reinsurance Program. It does apply to carriers as well, but it's really more important to self-funded plans. We know it applies on a per-member basis, and it's only for a few years. It's intended to stabilize premiums in the individual and exchange markets. And we have heard estimates all over the board for this requirement that it could be anywhere from $10 per member per month up to $80 or $100 per member per month. HHS hasn't given us the data yet that we need to better estimate this fee, but this is out there, and it is causing a bit of consternation among employers because they're not able to plan for it yet. If you are self-funded, you should be talking with your account manager or your consultant at BIS, and as soon as we know more, we'll certainly let our friends and clients know. Very briefly, I want to talk about the individual mandate and the premium subsidies, just so we understand the basis behind the employer mandate and those penalties. Essentially in 2014, most individuals must maintain health insurance coverage or pay a penalty for noncompliance. There are a number of exceptions. Perhaps most importantly is the last one on the left there, that any individual who doesn't have a federal income tax filing obligation is exempt from this mandate. So as we know from some recent statements by our presidential candidates, that there's a great number of people that do not have a federal income tax filing obligation, and so therefore those folks won't be subject to this individual mandate. The penalty is based on a sliding scale. It's a greater of these two amounts. It's a little tricky. I don't want to waste too much time on it. But I think it's important to talk for a second about the collection of the individual mandate penalty tax, whatever you want to call it. It is a bit of a paper tiger in that the IRS can only attempt to collect the tax by reducing future tax refunds. They can't throw you in jail or seize your house if you don't pay the individual mandate penalty. And so the question that is often asked by curious individuals is, why is the individual mandate necessary? And it's really necessary to combat the instability caused by the government's community rating price controls, essentially. Part of healthcare reform is a requirement that carriers charge individuals of a given age the same premium regardless of their health status, and this is known as community rating. And it reduces premiums for those with pre-X conditions, but it increases premiums for lower risk households. And so what this does is it encourages healthier households to wait until they fall ill to purchase the health insurance. So, and of course this causes adverse selection. The influx of the high-risk consumers and the exodus of the low-risk consumers obviously causes premiums to rise, and this leads to additional low-risk consumers or customers dropping coverage, leading to further price increases and so on. And so it's necessary to have this individual mandate to essentially keep these folks in the system. The health insurance premium tax credit, this again is the gateway to a penalty under the employer mandate. If no employees are eligible for premium tax credits, then the employer cannot be subject to a pay-or-play penalty. Essentially, folks that are not eligible for Medicaid, so either people that are either under 100% or under 133% are Medicaid eligible, depending on the state. So folks over 100 or over 133%, but under 400%, may be eligible for these federal premium tax credits. And there's some additional cost-sharing credits for folks under 250% of the federal poverty level. So if you are between that 100 and 400% of the federal poverty level, and you are not eligible for minimum essential coverage, then you can obtain a federal premium subsidy. And we see here that for purposes of the individual mandate, meaning what will satisfy an individual's requirement to purchase coverage is any employer-sponsored group health plan, no matter how much it costs and no matter what it covers. Now, if that plan doesn't meet the affordability requirements and the employee declines to enroll for that coverage, then the employee can trigger a pay-or-play penalty on the employer if he enrolls in an exchange plan and receives a federal premium subsidy. So in other words, no matter how bad the plan is, if an employee enrolls in it, then it's minimum essential coverage for mandate purposes. And here we have a blurb on the FPL, and so in 2012, 400% of the FPL is about $45,000 for an individual and $92,000 for a family of four. So Obviously, we're going to have some employers that are under, some employees that are under this 400% level. I want to move through the exchanges and concentrate more on the pay-or-play mandate, and I want to save some time for questions at the end. So, as you've probably heard, in 2014 we have this pay-or-play mandate, and it essentially requires what they refer to as large employers, and those are employers with 50 or more full-time equivalent employees. It requires these large employers to either pay a penalty or play by offering quality and affordable health insurance coverage to their employees. There are two penalty regimes under health care reform. The first one applies to an employer who has opted out entirely of providing benefits, meaning that the employer has decided it's no longer going to offer health coverage to its full-time employees. And so under this penalty regime, this is the more costly of the two penalty regimes. If at least one full-time employee on a 30-hour per week standard receives a federal premium tax credit or federal premium subsidy and enrolls in exchange coverage, then the employer is subject to an annual penalty based on all full-time employees minus the first 30 if even one employee receives a federal premium tax credit. So the penalty for opting out entirely as an employer is fairly substantial, and we don't expect too many employers, particularly those who are on the call today, to be contemplating opting out entirely. The more likely thing to happen is the employer may not offer coverage that meets these quality and affordability standards, which I'll talk about in a second. But to give an example of how this first penalty regime works, this $2,000 penalty, if no full-time employee receives a tax credit, then there's simply no penalty assessed. If one or more full-time employees receives a tax credit, then you calculate the annual penalty by taking the total number of full-time employees, subtracting 30, and then multiplying that by 2,000. And so in our example here, if there's 50 full-time employees, then if either 1 or 20 or 30 or 50 employees receive the credit, then the penalty is the same, and it's 50 minus 30, or 20, multiplied by 2,000 for a total of $40,000. The second penalty regime is a bit more likely, and this penalty is essentially a $3,000 penalty for each full-time employee who actually receives a tax credit, whereas the prior penalty we talked about applies to all full-time employees regardless of whether they receive the credit or not. This one is a per employee penalty based only on those who received a credit. So when does this apply? This applies if the plan fails to provide quality and affordable coverage. And coverage is affordable only if the premium for single coverage does not exceed 9.5% of household income, or W-2 wages can also be used as a safe harbor. So there's the 9.5% threshold, meaning that the cost for single coverage cannot exceed 9.5% of W-2 wages, and the plan must provide at least a 60% actuarial value. And the government's going to give us some guidance and a couple of calculators that will help us determine whether our plans have a 60% actuarial value, but both of these requirements must be satisfied to avoid that $3,000 penalty.